Okay, good morning, everybody. Dr. Rafich here from Triage, Friday, October 4th, 7:28 a.m. Pacific time. We are going through this JAVMA issue from December 15, 2017, and we're going to talk about suspected zonisamide-related anticonvulsant hypersensitivity syndrome in a cat. And this is from out of a hospital in Los Angeles, VCA West LA. It's a case series, so we'll go over the case itself in some detail, but the benefits to reports like this usually are in background information that are very interesting to know. I'm surprised this case itself got published. It's missing some information, I think, that maybe are essential in claiming a zonisamide-related anticonvulsant hypersensitivity syndrome in a cat, but it does say suspected, so somehow it got through, but we'll go over. There is some valuable information here. So, as a summary, this is a 2-year-old male neuter domestic short-haired cat that went to an emergency hospital. They found hyperimmunoglobulinemia and thrombocytopenia. So, hyperimmunoglobulinemia means an elevation in immunoglobulins, which are basically antibodies in the body, and then thrombocytopenia are low platelet counts. The pet was being treated with 3 different anti-seizure drugs, levetiracetam, which is Keppra, zonisamide, and phenobarbital. And the diagnosis was epilepsy, so idiopathic epilepsy. 2 weeks later, they evaluated the cat and measured phenobarbital levels. So for some drugs in our profession, you have to monitor their serum levels to make sure that the blood value, the blood concentration of that drug is within therapeutic range. Anything less than therapeutic range is considered subtherapeutic. So that probably doesn't help the patient. And anything above therapeutic range is in the toxic range. And so you'd want to lower those medications and potentially replace it with another medication or something like that. So phenobarbital is one of those drugs, and so is zonisamide. They found that the phenobarbital concentration was fine, but the zonisamide was excessive. They then decreased the zonisamide. A few days later, the cat developed a generalized lymphadenopathy. So generalized means all over the body, and lymphadenopathy is in large lymph nodes. I do have a live stream on this channel talking about lymphadenopathy, and essentially there's 3 causes for lymphadenopathy: inflammation, infection, and cancer. And inflammation can be also reactive. Those 2 things are in the same category. So they did test the lymph nodes, and they came back as reactive, and they suspected hypersensitivity to phenobarbital, so the treatment was discontinued. And and so that was based on the fact that zonisamide levels were high, so they lowered the zonisamide levels. But despite that, the cat developed enlarged lymph nodes, and so they said, well, maybe he's just sensitive to phenobarbital, even though his phenobarbital levels were normal. So despite stopping phenobarbital, the lymph node enlargement continued, and the cat had high globulins again. It had cytopenias, which is low blood cell count across the board. Now, if you say pancytopenia, that means every cell lineage is low. Platelets, basophils, eosinophils, neutrophils, lymphocytes, red blood cells, platelets. But if you say cytopenia, you have to define which cell lineage you're talking about. So anyway, once they stopped completely the zonisamide, then these abnormalities went away. So to the author's knowledge, it's the first case report of a zonisamide-related lymphadenopathy, hyperglobulinemia, and cytopenia in a cat. Anticonvulsant hypersensitivity syndrome is well documented in human medicine. So let's go through it. So the cat's initial symptoms that started all this was shaking, hypersalivation, and vocalization. Other than gingivitis, the cat's physical examinations have been normal. The referring veterinarian to the emergency hospital started the cat anti-inflammatory. We don't know which one. When they saw the cat on an emergency basis, they found normal blood pressure, low platelet count, high protein count. So hyperglobulinemia, which we mentioned before, is elevation in antibodies. That's a protein. And so if you have hyperproteinemia, it's either going to be high albumin, which is also measured, and it was high in this cat, high immunoglobulins, which is high in this cat, or both. And that's what elevates the total protein, which is hyperproteinemia. They found hypermagnesemia, which is high magnesium as well. Thoracic radiographs were normal. They tested the cat for feline leukemia and feline immunodeficiency virus. Those were negative. They also tested for other infectious agents, such as coronavirus, cryptococcus, and toxoplasma, all negative. They started the cat on a loading on diazepam, which is Valium, to stop the seizure activity, and a loading dose of phenobarbital. Now, phenobarbital, those are not familiar with it. There's a two-staged attack with phenobarbital. You start with a loading dose, so a high dose of phenobarbital to increase those blood serum levels to therapeutic range quickly, and then you maintain them on a lower dose of phenobarbital. So there's a loading phase and a maintenance phase. Then they started Keppra on the cat. They measured bile acids, which tests for all intents and purposes liver functionality. They performed the MRI and a cerebrospinal fluid analysis, which is normal. So MRI is magnetic resonance imaging of the brain, and they didn't see any brain tumors or infections, infarctions. So the rule out was epilepsy. And then the CSF analysis, which is cerebrospinal fluid, so spinal fluid tap, was also negative for any cancer, inflammation, infection. So they then added in zonisamide. 2 weeks later, they had the cat in to measure those blood serum values, and the phenobarbital was fine. Zonisamide was excessive. So then they decreased zonisamide. Then they saw the cat a few days later for the large lymph nodes, which came back as reactive. So then they thought, okay, maybe it's a phenobarbital hypersensitivity. So they stopped that drug. Then a few weeks later, the cat came in for lethargy and anorexia. The cat had leukopenia, so low white blood cell count, characterized by neutropenia and lymphopenia, so low neutrophil and low lymphocyte. Here's what I want folks that watch this understand about lymphopenia and lymphocytosis, or leukopenia and leukocytosis. So if you're interpreting a CBC, complete blood count, this is the appropriate way to do it. If you notice the white blood cells are high, which is leukocytosis, or low, which is leukopenia, you want to follow that up by saying characterized by. So if you just tell me leukocytosis, meaning high white blood cell count, it doesn't tell me what white blood cells are high. It just tells me that the white blood cells are high. And so you want to say leukocytosis characterized by a neutrophilia and a monocytosis. So neutrophilia is high neutrophil count, monocytosis is high monocyte count. But the point is you want to describe it. You do the same thing for anemia, for example. You don't just describe anemia, you describe how severe it is. Is it hyperchromic or hypochromic? Is it microcytic or macrocytic? Is it regenerative or non-regenerative? Those terms are added to the anemias that when you're speaking to somebody, another doctor, and you're documenting it in the medical record, for example, that we all know what you're talking about. So hyperproteinemia was also found, which is the high protein count, like we mentioned before. They then added oral Valium. A week later, the cat was brought in again for more seizures, and they found on the blood work now anemia, low sodium, low potassium, high chloride, high magnesium, and the protein levels were also high. So then they hospitalized the cat and started phenobarbital again, supported the cat's electrolyte derangements, continued with Valium, Keppra. They added a dose of steroids just one time, helped with brain swelling, I presume. And then let's say they were rechecking the cat. 3 weeks after that, the cat had developed upper respiratory tract infection, suspected to be viral. Okay, so now into the discussion. So a drug-induced cutaneous reaction due to the aromatic anticonvulsant phenytoin was first recognized in humans in 1938. It was termed phenytoin syndrome. So that's in people. I'm not familiar with phenytoin in animals. It may be an old school drug. It's phenytoin. But drug-induced cutaneous reaction means after you're given a drug, you develop some sort of skin rash or skin abnormalities, and that's termed drug-induced cutaneous reaction. There have been other names, including pseudolymphoma, drug rash with eosinophilia and systemic symptoms, drug-induced hypersensitivity syndrome, and anticonvulsant hypersensitivity syndrome. These are all in humans. Pseudolymphoma, which if you hear about it, might think, boy, does that mean it's cancer? It means it looks, they when they test the patients in humans, it looks like lymphoma, which is a cancer, for between 1 week and 2 years following exposure to the drug. And this condition represents a subacute drug eruption that usually encompasses single to multiple cutaneous nodules without signs of systemic disease. So in humans, if you're on an anti-seizure drug and you develop skin issues plus signs of lymphoma, you may want to rule out pseudolymphoma so you don't start going through chemotherapy and stuff like that inappropriately. Phenobarbital-associated pseudolymphoma has been reported once in the veterinary literature, and it was a cat with enlarged lymph nodes. Clinical signs of anticonvulsant hypersensitivity syndrome include a fever, high eosinophil count, enlarged lymph nodes, cytopenias, internal organ development. So eosinophilia means an elevation in eosinophils. Eosinophils are involved with hypersensitivity reactions. It's a typical type 1 hypersensitivity that we keep referring back to on these live streams. So it's not surprising that eosinophils are high if you're diagnosing a hypersensitivity reaction. So one thought as to why such drugs cause these things, and this is going to get a bit more, organic chemistry. So we're not going to go into too much detail because a lot of these terms are not clinical for me, but we'll just do it in case folks who are watching this find it of interest. So these hypersensitivity reactions are usually due to aromatic anticonvulsants. These are drugs that contain a benzene ring that must be metabolized by cytochrome P450, producing multiple metabolites, including arene oxides. These compounds that are made through the metabolism of these drugs must be conjugated by epoxide hydrolase in the body to prevent their accumulation from being toxic. The accumulation of arene oxides within cellular macromolecules may be the trigger for a secondary immunologic reaction, and it's thought that people who develop anticonvulsant hypersensitivity syndrome have a hereditary deficiency in epoxide hydrolase, which is the enzyme that's supposed to take care of potentially toxic intermediate metabolites. I hope that makes sense for folks who are watching it. It's a lot going on there. Aromatic anticonvulsants include carbamazepine, phenobarbital, and phenytoin. However, there have been reports of anticonvulsant hypersensitivity syndrome with non-aromatic anticonvulsants such as valproate, lamotrigine, and zonisamide. This suggests alternative mechanisms. So other thoughts besides the aromatic anticonvulsant mechanism that we said, they think maybe it could be a graft versus host disorder. It could be an allergic hypersensitivity reaction. It could be drug-induced immunosuppression. All right. Sometimes in people, they'll use a tapering course of steroids, although it's controversial. When people develop anticonvulsant hypersensitivity syndrome, there has been association in people between herpes virus infection and the syndrome, but it remains unclear whether or not reactivation of the herpes virus occurs secondary to immunosuppression or whether the severe primary infection with or reactivation of the virus is the cause of the large lymph node and systemic signs. So they don't know whether or not the virus caused the hypersensitivity or the hypersensitivity caused recrudescence of the virus. But because this cat developed an upper respiratory tract infection a few weeks later, they think, well, maybe there's some sort of viral connection with this syndrome in cats as well. Phenobarbital is still the treatment of choice for an anti-epileptic agent in cats with idiopathic epilepsy. They report a 44% seizure remission rate in cats using phenobarbital as a sole treatment. So for those who are not familiar with how to manage seizure patients, you try one drug, whatever the drug is considered ideal for that patient. And if that drug doesn't work, typically, assuming you're at the appropriate dose and frequency of that drug, you then add in a second drug. And if that doesn't work, you add in a third drug. And so there are lots of patients who are receiving polypharmacy who have seizures because of the lack of response from one drug or the other. Or some patients just need one drug. So it just depends. So other seizure drugs include potassium bromide, which is KBR. There also used to be sodium bromide, NABR. That's a bit old school. Diazepam, which is Valium, Keppra, and Zonisamide. But the problem with potassium bromide is there's a risk of idiosyncratic allergic pneumonitis. Idiosyncratic meaning related to, well, what's believed to be related to drugs. Allergic is like an allergy, type 1 hypersensitivity. Pneumonitis is inflammation of the lungs. And also with Valium, especially the oral form in cats, there's a risk of fatal drug-induced hepatic necrosis, so liver failure. So it's surprising that they use oral diazepam in this case for a long time in this cat, and the cat didn't seem to develop liver necrosis. So now zonisamide. Zonisamide is a sulfonamide anti-epileptic drug. It is thought to suppress seizures with a bunch of different mechanisms. We're going to go through it for the sake of being thorough, but this may be too much information for some of you folks watching this. It certainly is for me. So it causes suppression of the propagation of seizures by blocking voltage-gated sodium and T-type calcium channels in the brain. It facilitates dopaminergic and serotonergic neurotransmission. It scavenges free radical species. It enhances GABA in the brain, which is gamma aminobutyric acid. It inhibits glutamate-mediated neuronal excitation in the brain, and it inhibits carbonic anhydrase activity. So there are 6 different mechanisms that are thought to be the reason why zonisamide works. Zonisamide-associated anticonvulsant hypersensitivity syndrome is well documented in humans, and case reports in humans found kidney disease, multiple myeloma, and eosinophilic pneumonia in humans. Adverse effects of zonisamide in the veterinary medicine literature include anorexia, diarrhea, vomiting, sleepiness, and ataxia. Kidney disease, skin disease, and liver disease have been reported in dogs exposed to zonisamide. In the present report, this is the first suspected zonisamide-related case in a cat. The low white blood cells and the high globulins, they admit, could have been further evaluated by a slide agglutination test and bone marrow evaluation, but they said because the owners had financial limitations, they couldn't do that. And this is my problem with this paper is, usually if you're claiming something, again, they do say suspected, you want the case to be as thorough as possible. So I've seen other cases thrown out and not published because they were lacking diagnostics like this. So I'm a bit surprised about it, but it's useful information for us anyway. Lastly, the last way to diagnose zonisamide hypersensitivity is like you'd stop it and the pet's signs resolve, and then you restart it again and then see if the symptoms come back. And the reason why they didn't do that is because it would be the cat's best interest to do that, so they decided not to. But really, a diagnostic therapeutic trial like that is the way to go. And then finally, they said that they realized that the liver could have been affected by the oral Valium, but they thought it was better than the alternative, which is the cat having life-threatening seizures. And so they weighed the pros and cons, the risks and benefits, and decide on using oral Valium. And that's really important for the vets who are listening to this, especially. You need to be able to discuss pros and cons with pet owners so that they know what they're getting themselves into. As long as they agree to it, then you should be in the safe zone. All right, and that finishes up this JAVMA December 15, 2017 journal. We'll move on to another one for the next live stream. Thanks for everybody who watches. I hope you guys find this useful. Take care.